Opioid use in the U.S. is rampant, despite the fact that these medications can be misused, abused, and have significant side effects. Unfortunately, during the spring and summer months, even more opioids will be prescribed as thousands of high school graduates and college students plan to visit an oral surgeon for procedures. That includes wisdom teeth removal. Here with more and important facts to know, especially when it comes to managing pain, is Dr. B.D. Tyner. Great to have you on the show this morning. Good morning.
Hi, Stephanie. Thanks for having me.
So we're talking about how especially it is important to manage that pain for patients, and it's a big concern for healthcare professionals, especially in light of the opioid epidemic. So how does this epidemic impact the oral surgery community?
Well, Stephanie, we know that in 80% of the cases, young adults, their first exposure to opioids is when they have their wisdom teeth removed. And if given a choice on how to manage their pain, 70 to 80% of those patients would opt to have a non-opioid way of managing their pain.
And you actually, in your practice, you regularly use a non-opioid medication for oral surgery, right?
Yes, in the last eight to 9 months, we've been using a new drug that was introduced to the oral surgery market, and that drug is called Exparel. Exparel is similar to Novocaine, and I'm sure all of your audience at some time or another have had their jaw numb for a filling from their dentist. This drug is injected into the surgical sites at the end of the procedure while the patient's still under sedation, and it gives long-term pain relief in the postoperative period for these patients.
So, I mean, many people, especially young adults, are first exposed to opioids following oral surgery procedure. As I mentioned before, wisdom tooth removal. I know a lot of us have been through that before, but what should parents and patients know prior to surgery to help manage that pain?
Well, first of all, some studies from academic pain management centers have shown that patients that are given opioid prescriptions, about 10% of those will go on to have an addiction or abuse problem. So that's something to keep in mind. Parents need to know that today we have options on how to manage the postoperative pain from wisdom tooth extraction without having to take opioids. In our practice, the patients that have chosen to use Exparel, 50% of those have not taken any opioids postoperatively. They've only taken some Motrin or Aleve or Advil. The other 50% of the Exparel patients have only taken 2 to 3 opioids to manage breakthrough pain, as opposed to patients who don't take the Exparel option and just use the opioids, and they take up to 20 opioids to manage their postoperative pain.
Wow, what a difference. And what have you seen in your practice? Are you seeing an increase in more patients asking for the non-opioid treatment in your practice?
Yes, as more and more patients and caregivers and parents become aware of the opioid crisis, which, as you know, every day in the newspapers, on TV, and in emails, there's story after story of how bad the opioid crisis is. So we have more people asking for non-opioid ways to manage that pain.
Any final thoughts you want to leave us with, or anyone that might be heading into oral surgery and faced with that decision on what to take? Any final thoughts as we close here?
Yes, the take-home message, there's a great website, oralsurgeryprep.com. I would encourage patients and parents and caregivers to go on the web and look at that website. It gives you several suggested questions that you can download and print, and take those with you when you have your preoperative consultation with your surgeon, and just have a frank discussion with your surgeon on pain and pain management and options on how to manage that pain without having to take opioids.
Thank you so much for joining us today. A great resource there. Again, oralsurgeryprep.com. Check that website out. And then if you have any questions or maybe want to learn more about what Dr. Tyner talked about, head online, check us out. We'll have this interview at fox4morningsblend.com.